Welcome to the teleconference session, which is a special session for prevention and control of tuberculosis. In this session, we will be targeting the general audience for awareness and our nursing students, for which details will be detailed by Dr. Reeta in the latter part. As you know, tuberculosis is a communicable disease and it is rampant throughout the country. Indeed, we call in Hindi as क्षय रोग. So this affects primarily the lungs, जिसको हम फुफड़े बोलते हैं, and it also affects all other organs. ऐसे कई organ नहीं है शरीर में जिसको टीबी हो नहीं सकता है, ट्यूबरकुलोसिस का जो ऑर्गेनिज्म इफेक्ट नहीं कर सकता है. तो इस बीमारी को कंट्रोल में लाने के लिए गवर्नमेंट ऑफ इंडिया 1961 में एक प्रोग्राम शुरू किया, जिसको डिस्ट्रिक्ट ट्यूबरकुलोसिस प्रोग्राम हिसाब से शुरू हुआ था, क्योंकि तब तक ये पता नहीं था कि ये बीमारी को लड़ेंगे कैसे, इसके लिए क्या दवाई होगा. तो सर्वे करके एक्सपेरिमेंटली एक ट्यूबरकुलोसिस डिस्ट्रिक्ट ट्यूबरकुलोसिस प्रोग्राम हुआ. फिर 1962 में एज ए नेशनल प्रोग्राम, इसको नेशनल ट्यूबरकुलोसिस कंट्रोल प्रोग्राम हिसाब से गवर्नमेंट ऑफ इंडिया लॉन्च किया थ्रू आउट द कंट्री. ये जो ट्यूबरकुलोसिस कंट्रोल का मतलब, हम बीमारी को जो नंबर ऑफ पेशेंट्स वो विद इन ए सेटिस्फैक्टरी लिमिट रहेगा. ये नहीं कि बीमारी ख़त्म हो जाएगा, बीमारी रहेगा लेकिन उसको अंडर कंट्रोल रहेगा. इसलिए इसको नेशनल ट्यूबरकुलोसिस कंट्रोल प्रोग्राम हिसाब से लॉन्च किया गया. तो अराउंड 30-35 साल का बाद इसको रिवाइज किया गया एंड उसका नाम हुआ रिवाइज्ड नेशनल ट्यूबरकुलोसिस प्रोग्राम और RNTCP. तो ये जो रिवाइज्ड प्रोग्राम हुआ, इसमें कुछ कदम गवर्नमेंट ने लिया, जिसमें डॉट्स, इसका मतलब शॉर्ट कोर्स केमोथेरापी, इसमें जो दवाइयाँ दिए उसको डॉट्स थेरापी इसमें इंट्रोड्यूस हुआ, और बहुत सारे ऑर्गेनाइजेशनल रीअरेंजमेंट हुआ. फिर और 10-20 साल का बाद 2017 में गवर्नमेंट ने एक बड़ा कदम उठाया कि ट्यूबरकुलोसिस को ख़त्म करना है. पहले ये प्लान था कि स्टॉप ट्यूबरकुलोसिस, ये ग्लोबल एजेंडा था, लेकिन गवर्नमेंट ऑफ इंडिया ने इसको और एक आगे ले गया और उसको बोला कि वी शुड एंड ट्यूबरकुलोसिस. सो स्टॉप ट्यूबरकुलोसिस बिकम द टारगेट फॉर एंड ट्यूबरकुलोसिस. तो एंड ट्यूबरकुलोसिस का मतलब हम बीमारी को ख़त्म कर देंगे, ना कोई बीमार रहेगा, ना कोई उसी में डेथ, उसका कोई डेथ होगा. तो इसीलिए ये जो एंड ट्यूबरकुलोसिस के लिए उसको कैंपेन बढ़ाने के लिए गवर्नमेंट ने बहुत सारे कदम उठाया है. उसमें 100 डेज का अभी एक स्पेशल कैंपेन चल रहा है. इस सिलसिले में हम लोगों ने ये स्पेशल टेलीकॉन्फ्रेंस ऑर्गेनाइज किए हैं. तो मैं रिक्वेस्ट करूँगा, हमारा साथ डॉक्टर रीता देवी हैं. शी इज़ एसोसिएट प्रोफेसर इन दी नर्सिंग एंड वी आर रनिंग सम नर्सिंग प्रोग्राम्स, जिसमें ये ट्यूबरकुलोसिस का भी हमारा यूनिट है. तो आई विल रिक्वेस्ट डॉक्टर रीता टू कवर सम इम्पोर्टेंट कंपोनेंट्स रिलेटेड टू प्रिवेंशन एंड कंट्रोल ऑफ ट्यूबरकुलोसिस. डॉक्टर रीता प्लीज़.
थैंक यू सर. आपने बहुत अच्छी तरह से जस्ट बताया ट्यूबरकुलोसिस का कैसे शुरू हुआ, किस तरह से हम नेशनल हेल्थ प्रोग्राम्स करते हैं. तो अगर हम इस स्लाइड में देखते हैं, आपने सर ने भी बताया कि ट्यूबरकुलोसिस कैन इन्फेक्ट एनी वन. दिस मीन्स आप इस स्लाइड में देखोगे एक छोटे बच्चे से लेके स्कूल गोइंग एडोलेसेंट, मेल फीमेल, वेदर रिच और पुअर, or living in urban or rural area. That means anywhere anybody can be affected with tuberculosis. Tuberculosis most commonly affect the economically productive age group. That means जो बहुत ज़्यादा प्रोडक्टिव एज ग्रुप है, जिसमें यंग जनरेशन हम बोलते हैं, बिटवीन 18 to 35 ईयर्स ऑफ एज, जिसमें हम बहुत अच्छी तरह से कमाई कर सकते हैं, उस एज ग्रुप को ये ज़्यादा अफेक्ट करती है. बट at the same time good thing is that it is 100% curable. और उसके लिए क्या ज़रूरी है? treat on time, early identification of cases and early complete कोर्स ऑफ ट्रीटमेंट, तभी हम सुरक्षित रख सकते हैं एक मरीज को भी और उसको आगे आने वाली कॉम्प्लिकेशन से बचा सकते हैं. सो टू कंट्रोल ट्यूबरकुलोसिस वी हैव टू ब्रेक द चेन ऑफ ट्रांसमिशन. और कैसे स्प्रेड होता है, एयरबोर्न है, इसको स्प्रेड करने से रोकने के लिए दवाई की ज़रूरत ही है और कोई इसका दूसरा इलाज नहीं हो सकता. तो हमें चेन को ब्रेक करना होगा, क्योंकि एक स्पुटम पॉजिटिव केस अगर अपने आसपास के 10 से 15 हेल्दी लोगों को इन्फेक्ट कर सकता है ट्यूबरकुलोसिस से, अगर वो अपना इलाज नहीं करवाता है. क्योंकि आपने कई बार देखा होगा, ये हमने बहुत केसेस ऐसे देखे हैं कि वो 1 महीना 2 महीना पहले खांसते ही रहते थे, दवाई खांसी से उनका काम चल रहा है एंड दे आर नॉट बॉदर्ड कि इसको जाके चेकअप कराएं. लेकिन जैसे जैसे अवेयरनेस बढ़ी, गवर्नमेंट ऑफ इंडिया ने इसको और इंटेंसिफाई किया और RNTCP चलाया और अर्ली आइडेंटिफिकेशन पे जोर दिया, तो उससे जो है हम स्पुटम पॉजिटिव केसेस को जितनी जल्दी पकड़ में लाएंगे उतनी जल्दी हम जो है बाकी लोगों को इस इन्फेक्शन से बचाने में हेल्प कर सकते हैं. तो इंडिया हैज़ मेड सम प्रोग्रेस. इफ़ it continues to have the highest disease burden, अभी भी हमारा disease burden highest पे ही है. So it spread as through air, and when a TB patient affected with the lung tuberculosis, when he coughs or sneeze or spit here and there, he spread these droplets or the Mycobacterium tuberculosis bacilli. As per the Global TB Report 2024, in India, 37 citizens die due to tuberculosis every 1 hour. That means you can see that the number of deaths is still every 1 hour 37 are dying. So TB is one of the top burdensome infectious disease in India, and it is estimated that around 28% of the world's new TB cases occur in India. So if we see the translating it to about 30 lakhs new TB cases emerging each year. It is the Global TB Report 2024 which is giving this data. So if you see this map, every part of India is affected. However, the incidence varies from very high to little lower, but every state is affected due to tuberculosis. As in 1962, National Tuberculosis Control Program was started, and later on, seeing the various failures in that program, many modifications were carried out, and RNTCP, which was launched in 1997, and the main emphasis was on the DOTS treatment, that is directly observed treatment for short duration. So we will see what all revisions were done in that program so that we can catch the TB patients. So first and foremost, the most important, which is the need of the hour, was political and administrative commitment. So if the political will is there, then we can do many wonders, and which has happened in even tuberculosis. Second was that good quality diagnosis, primarily by sputum microscopy examination, and it should be done in a designated microscopic laboratory to give the good results. And third revision is uninterrupted supply of good quality drugs. You know, previously drugs were not available, and patient were suffering with some or one or the two medicine, and rest they had to buy. But in this, they were given all the medicines free of cost, and directly treatment was given where the health worker is answerable for the complete course of treatment of the patient, and systematic monitoring and accountability was there on the health system. That is why these revisions were very important. And if you see the gist of tuberculosis, I will just revise. You all are every day working on the field of and looking after patients. As you can say in one line, what is tuberculosis? You can say TB is an infectious airborne disease. It is very clear it is caused by the microorganism called Mycobacterium tuberculosis, and there can be TB in the lungs, which is, we are again, because 80% of the cases are with the pulmonary tuberculosis, and rest 20% of the cases it can affect any organ of the body, and which is spread through droplet nuclei. If you see this slide, you can see the bones, intestine, kidneys, and lymph glands, spinal cord, brain, and in the center, lungs. So 80% cases are occurring of pulmonary tuberculosis, and rest it can affect any organ of the body, even skin. So if I think you all are knowing about the signs and symptoms of tuberculosis, this is very important for all of you to know all these symptoms, because you are going to identify or recognize these patients in the community. Like cough for more than 2 weeks of duration, patient complains of loss of appetite, low grade evening rise fever for more than 2 weeks. Again, there is a significant weight loss, and if any abnormality in the chest X-ray, that also is suspected case, and there can be complaint of night sweats. If you will not see night sweats, but you have to ask in the history, or you when examining the patient, you need to ask. Also, in addition, the contacts of, suppose a patient is suffering with TB, and in the same house there is a person living with HIV, or there can be a diabetic person in that house, or malnourished person can be there, cancer patient can be there, patient on immunocompromised medicines or on steroids should be regularly screened for signs and symptoms of tuberculosis. So at the same time, you are not only asking the patient, but you can ask that patient if any of these are there in their house, because they are at most risk to catch the opportunistic infection from the patient. So if you again see this slide, in the center, the patient who is coughing, and he can have chest pain, the food is lying in front, but he does not want to eat, there is loss of weight, as well as thermometer in the mouth shows that low grade fever. So you can remember these symptoms. And in case of extrapulmonary tuberculosis, the presence of organ specific symptom, as you study in the anatomy and physiology, various organs and their functions of various organs. So if any organ is affected with tuberculosis, suppose bone is affected, it is not easy to identify these cases, but the patient will complain of some pain, and the pain may linger on, and not getting any relief due to any medicines. So it can be the TB of the bones. And similarly, if there is a gland which is swelling, so you have seen the lymphadenopathy on the neck region, or this lump can be painful also. At the same time, the constitutional symptoms like significant weight loss, persistent fever for more than 2 weeks duration, or night sweats, these are associated along with the organ specific functional disability, so that you have to ask for the extrapulmonary tuberculosis. In case of mode of spread of tuberculosis, as we are emphasizing that a TB patient, when he coughs, he spread droplets in the air, and if he spits here and there, and you have to tell that this behavior can also spread tuberculosis. And in third picture, if you see the contact of the TB patient, so if they are in close contact with each other, that can also spread infection. So as we told that one of the revision was good quality sputum microscopy. So that has to be there for diagnosis the cases of sputum. And in case of the pulmonary tuberculosis suspects, their sputum, they have to give 2 sputum. How many sputum samples are to be given? 2 sputum samples. One sample the patient gives on spot, when he comes to the DOT center, there he gets the collection this thing bottle, and in which he will give his sample, and second bottle is given to the patient, so in which he will bring overnight sputum. So this way 2 sputum samples are required for the sputum microscopy. And in case any more symptoms are there or condition of the patient is such that it needs X-ray also, so X-ray can also be done. And at the same time, there are nowadays more tests are available. These are molecular tests like Gene Experts, or where the facility available for CB0, this is also available for early diagnosis, and all these tests are free of cost. So patient should not be worried that I don't have money where I will go and get these tests done. So these are free of cost in the designated microscopic laboratories. So all TB patients should have access to good quality diagnosis as well as treatment services. These are affordable and convenient to the patient in their time, place and person, because these are within a 1 kilometer distance. Every 1 kilometer distance there can be DOT center, so patient does not have to travel a lot or spend money on travel also. So they can go and get that treatment. So goal of the anti-TB treatment, there are various facilities available which are again free of cost. One, the patient is diagnosed with the case of tuberculosis, so he need to get the complete full course of treatment. And also you have to tell about the side effect of these medicines, so that patient is not afraid when he is having some temporary side effects. So you have to explain them that these are temporary side effects, but the long-term benefit of taking these medicines is that patient will have 100% cure. And because treatment will only ensure cure, at the same time it will prevent death. And you see, the prevention is better than cure. We always say this, and you all have to propagate these things. So prevent emergence of drug-resistant tuberculosis also. If the patient will take complete course of treatment for the duration which is prescribed, so he will be prevented from even resistant tuberculosis. But if patient neglect, within short time he is taking, then he is stopping in between, then again come and take, so that kind of behavior can lead to resistant tuberculosis. And there are various kind of drug resistance tuberculosis which are very difficult to even treat, and also which are costly also, because they need to have more medicines now. So you tell all these consequences of if they are not neglecting their treatment. And it is better early the diagnosis. Treatment should be as early as possible, within a week of duration. Treatment should not be delayed. As you see in this picture also, that health worker is there and he is directly supervising the dose of medicine. Water is available in the DOT center itself, drinking water, so the patient can have the medicine in front of the health worker. So various kind of treatment, we will not go in much of these details of these medicines, but medicines are available for fixed dose combination or three fixed dose combination for adults, and these are available as per the various weight zones, because every patient has individual weight category. So same way the medicines are available, and if the patient does not take medicines regularly, he can become an MDR case, and for which the duration of treatment is very long. So we will need to watch all these things, and all the close contact of TB patient also should be identified and get the TB preventive treatment as required, and rule out the active TB before you start the even prophylactic treatment for the close contact. Might be he is suffering with the, or she is suffering with the tuberculosis itself, but you have to ensure in case of contacts also not to be in a hurry, but you ensure their diagnosis also. And with this, it is very important that you advise or you do the counseling of TB patients, that he will be cured with the complete course of treatment, and after he is cured, he can live the life happily, as he can play, he can be with the family members, live happily with their and have social life, he can go to office, etc. So this slide is showing that thing. For prevention and control, it was a case of tuberculosis, but we don't want anybody should have tuberculosis. For that, what are the measures we need to take for preventing and control tuberculosis in the community? It is very important. As a health worker, you need to do the counseling, and in that counseling service you have undergone the counseling process. It is not only once you will counsel them, from time to time you need to counsel not only the patient who is on treatment, because the minimum duration of the treatment is for 6 months duration, but you also need to counsel HIV patient, or in case of diabetes patient, to keep their blood sugar testing and it should remain under control. Even the contact tracing, you need to counsel them that you bring them and get them identified for diagnosis, and then only they will be given the treatment. Along with that, there are various government initiatives like Nutrition Poshan Yojana. You need to tell these patients that this facility is available from the government. Like, even you can say that a cured patient can be a TB champion. He has win over the disease. So you can propagate all these things. Sorry. So the various initiatives are also, incentives are given by Government of India. In case of TB notification, if any private practitioner notify the TB patients who are coming there, so they get initiative of various duration, amount. And BCG vaccination you have to promote that it should be given at birth, and you have to check for the BCG scar in case of children, whether he or she is immunized or not. So early identification of cases, early treatment, regular and complete treatment to prevent TB, to cure TB and to prevent MDR TB, we can say. You have to, along with personal hygiene, you need to emphasize on cough hygiene. And it involves, patient has to be told that he need to cover his mouth with the handkerchief. That handkerchief in which he has coughed needs to be washed with soap and water and dry in sunlight, and always keep his mouth covered so that he does not spread disease in the air. The sputum which he is, spitting here and there should not be done. It should be kept, separately, dispose of in a safe, manner, and after collecting in some bowl and boil it and then only throw it, and ensure BCG vaccination, develop good immunity with the help of low-cost nutritious diet which they can afford, and also need to emphasize on treatment, preventive, TB preventive treatment. Reduce overcrowding, improve cross ventilation, very important, improve nutritional status, and advise to avoid smoking and alcohol. This is very, very dangerous for the patient, and It can even affect liver, so need to be avoided during the course of treatment. Also, if a patient is with diabetes, it is very common nowadays diabetic patients suffer with tuberculosis, so they need to maintain or control their blood sugar level so that they get maximum benefit of the treatment. And precaution with the steroid use. If the patient is on steroid, they need to take precautions to prevent themselves from getting infection. These all measures you as health workers need to emphasize in the community, in the hospital, or wherever you are there. You have to give this message of control, as the government of India has given this नारा, और वी कैन से दैट टीबी मुक्त भारत, ये एक हमारे देश के लिए बहुत इम्पोर्टेंट है. हमें टीबी मुक्त भारत को अचीव करना है. इस गोल को अचीव करने के लिए हमें अवेयरनेस की ही ज़रूरत है, और हमें ज़रूरत है कि हम इन साइन एंड सिम्टम्स जिसको भी है एक्टिवली वो पेशेंट को इस तरह से आपने मोटिवेट करना है कि वो खुद आके अपना चेकअप भी कराए. और गवर्नमेंट ऑफ इनिशिएटिव इंडिया का जो इनिशिएटिव 100 डेज़ की इंटेंसिव सर्चिंग चल रही है, उसमें एक्टिवली टीबी केसेस को आइडेंटिफाई भी कर रहे हैं और उनको काउंसलिंग की भी ज़रूरत है. तो हम सबको मिलके टीबी मुक्त भारत अभियान में सहयोग करना है और टीबी को जड़ से मिटाने का काम करना है. विद दिस वी hope that we could make out some difference by presenting today's discussion. In case there is any question, we can take one question only.
Thank you, Dr. Reeta. I don't think there is much time. I will just like to re-emphasize few points. Don't fear tuberculosis. Nowadays, tuberculosis can be cured. So don't hide it. And anyone having cough for 2 weeks or so, please go to a doctor, get your sputum tested. If the sputum will be positive, treatment will be given. Even if sputum is negative, you will be under observation, treatment will be followed up, and if required, they will do a X-ray and treatment will be done. If you are having tuberculosis, please ensure all your family members are also investigated, and so that anyone there is a chance of getting tuberculosis in your future, they can be identified early and it can be prevented. If you take tuberculosis treatment completely without any leaving the treatment in between, then tuberculosis can be cured. I think with these small points, we will conclude the teleconference. And I think as the students who are part of the nursing students, I think they will be benefited, and they can also propagate this as a student or as a caretaker in the society, so that we can defeat TB. And as our target is, we want to before 2030, Prime Minister has given a nara that we should do it by 2025. So India has advanced the target by 5 years, and with all effort, with the community help, I think we can defeat TB. Thank you.
Thank you.